Good morning, my internet friends. Welcome to the Medicare Cafe. This is the pre-chat section. So this is where we kind of get on here. Literally, I said, let's get on and start talking. Chandler said, what are we talking about? I said, I don't know. We'll figure it out as we go. So that's what we're doing. Today, we are continuing week 3 of our Cross-Selling Symposium. Technically, it's kind of week 4 because 1 week we kicked it off. Then we did home health care. Last week, we did dental vision hearing. This week, we're going to do hospital indemnity and talking about what products to write, why to write them, how to incorporate them in your sales, and everything in between. But we have 3 minutes of chaos before we get to actual useful and helpful information. Unless you do have questions, unless you want us to discuss something that we found in the news, anything going on that you just kind of want us to address regarding the industry. Good morning, Michelle. But other than that, we're just going to talk about what we want to talk about. So you're joined today by your hosts. My name is Olivia Richardson.
And I'm Chalon Jackson.
And I'm Chalon Jackson. I feel like you're going to give me the helicopter report. Not a report on helicopters. Traffic. The traffic report. Yes.
Gotcha.
Though a report on helicopters would be really cool. So again, we're just here to kind of talk about what's going on. So last week, for those of you guys, again, if you have any questions, text me at any time, or we're just going to talk about utter chaos until the actual show gets to rolling. But last week, I had the opportunity to go to the Aetna rollout, which was really interesting. Something that I thought was really cool that Aetna did was they spent a lot of time talking about industry updates. They actually hire a third party called Oliver Wyman. They are a consulting firm, but they were the ones behind kind of like last year notifying us back in April that last AEP was going to be just
a lot.
Bonkers bananas. And so they were here again last week telling us more about what to expect this AEP, and it's going to be a lot more bonkers bananas from my understanding, which
no, I would agree.
You and I are going to be doing a webinar on that later today with
We
Integrity
are.
as our disruptions webinar. If you want to register for that, you can go to our smsteam.net website,
2
click on the
p.m.
events.
Central Time.
Should be really fun.
It always is.
It should be. Well, fun's a strong word. I thrive.
Fun for me.
I thrive in chaos. I love chaos.
Yeah.
So if there's not chaos, I'll create chaos. That's the way that I work.
So we were talking about this before you got in here.
Oh, I know. I came in and everybody looked so guilty when I walked into the studio.
No. We were talking about art at that point. But so I was messing, I have my fountain pen. And
which it's a different fountain pen than the last one.
So I set that on the table, and Sadie said she thought it looked like a bullet.
I thought it was a bullet as well. I thought I was being threatened.
Then we talked about, so obviously I'm a big hunter and angler. And I know you'll resonate with this as well. We talked about like one of the biggest moments of anxiety that I have is like double checking all my bags before I get on an airplane.
Oh my gosh, yes.
Because it's like, what did I forget? Especially like usually my first trip of the calendar year is going out to Washington, D.C. for NABIP's Capital Conference. And usually my last trip before that was packing a bag to go hunting for a week with my buddies up in North Missouri. So there's always a little bit of anxiety of like, did I leave something in the bag that can't go through an airport security system?
Yeah.
Luckily, so far so good.
I've actually had that happen, not to me. It was one of the guys, obviously works with MMG, did that. And luckily it wasn't a firearm because like that's like a federal.
You
like
don't get on a plane again at that point.
Exactly. Like that's not like, I forgot this. Let me go put it back in my car. Like you're getting escorted and cavity searched. But it was like a giant machete. And again, it was because like huge. I think it was actually a fishing trip, and they're like, yeah, sometimes you had to cut through weeds and stuff. But I had this giant machete, and like, I forgot this, and we were just like, how did you forget a giant machete that lined the entirety of your bag? And it was because it was in a sheath that was the same material, same color as the inside of the bag, so they didn't see it. But, like, luckily that one they did say, like, okay, yeah, you can go put that back in your car. But we were already here for the flight, so, like, it was a lot of drama. A lot of drama. Good morning, Zach. Guys, it is time to welcome to the Medicare Cafe. Today, we're going to be talking about, again, continuing our cross-selling symposium we have today. And maybe a couple weeks left. Chalon, double-checking anything?
Hey.
Double checking everything sounds about right. Yeah. Nope, that makes 100% sense. Let's get into today talking about hospital indemnity plans. So what is a hospital indemnity plan? And I'm going to start off by saying if you ever refer to them as an indemnity plan, to your client or prospect, they will have no idea what you're talking about. So when you're talking about this with your clients, I call them hospital benefits. Just like, where are your hospital benefits through? And so, Chandler, you want to line out what exactly is a hospital indemnity plan?
Yeah. So, like most indemnity plans, it pays a flat dollar amount for specific life events. So, in this case, primarily targeted around an inpatient hospital stay, observation stay, various other things that you can add riders for, like ambulance rides, or even I've seen PT benefits or all sorts of things that you can add as riders. But the core of the product is you get admitted to the hospital as an inpatient. It pays out X dollars either per occurrence or per day that you are an inpatient in the hospital. It is about the simplest insurance to understand, the simplest to file a claim with. It really is just one of the easiest products to use.
Yeah. If this, then this. The way that when I'm talking to like somebody about like somebody who's non-insurance, right? Like a client or a prospect, the way that I like to sell or talk about or explain hospital indemnity is like telling the story of when does it become effective. So the way that I always do it is, okay, so it's Friday night. You have your kids for the weekend, right? Or you have your grandkids for the weekend. You're playing babysitter. Let's just start saying you have some uncomfort in your chest. You're just like, this is getting weirder and weirder. You start getting a little anxiety. You're thinking, you know what? It's probably time. I need to go to the hospital. I need to go to the emergency room. Step one, do you drive yourself or do you take an ambulance?
Yep.
A lot of people will say, I'm going to drive myself. Ambulance rides are incredibly expensive. Don't worry. This insurance can help cover that ambulance ride. Take the damn ambulance ride. It could save your life, right? And then once you get to the hospital, you're in the waiting room. They get you right in. Oh, I'm talking to my phone. They get you right in. Next thing you know, it's like, okay, well, they're looking you over. They're doing some tests. You're not having a heart attack. They're not quite sure what's wrong with you, though.
Sure.
You're now in observation care. No one has admitted you to the hospital. They just want to keep you in observation. Depending on your plan, that can end up and stack up some pretty significant costs. Don't worry. There's going to be something to take care of that. Next day, they're doing some more tests. It's time to admit you. You need to go ahead and you probably need to have a bed in this hospital. You're going to be here for a little while. For every day that you are in that hospital, for every midnight, for every day that you're in that hospital, you are going to get a lump sum of money per day that you're in that hospital. And that money is getting paid to you. So it's not getting paid to your doctor. It's not getting paid to the hospital. That money is paid for you. If you have a copay on a Medicare Advantage plan, it will offset the copay. If you want to use that money to have somebody come over and house sit and collect your mail, clean your house while you're not there, you have money to cover that. That money is used the way that you want. So that's how I describe it. But it's exactly what you said. It is money that is paid to the consumer if they go into the hospital. Now, some of the benefits I talked about were riders. The ambulance was the rider, and observation care is a standard benefit. But there's a couple other riders. What I love about hospital indemnity plans is that they can be very customized. So the basic benefits are you go in the hospital, you get coverage, but you can add things like cancer insurance lump sums. You can add things like short-term care stays. You can add things like ambulance riders and things like that. So it's a very basic plan, but for those individuals who want to feel like they have a custom package, for those individuals who maybe have a little bit more risk aversion, my favorite is the ambulance rider, because you know how many people, especially where you and I grew up,
Absolutely.
how many people, though they live so far from the hospital, it's embarrassing. Like, we have so much aversion to calling an ambulance, and so many deaths, especially when you're talking about heart attacks and strokes, so many deaths happen on the way to the hospital because they're driving themselves.
So last year, my grandmother had a seizure, and they had to call. Grandpa came home, found her on the floor.
Yeah.
Bad deal. They called 911, and the ambulance got there, but they said, "Listen, we're gonna have to put her on a helicopter and get her down to Boone Hospital." And that was a big deal. So, like, how many? And you grew up in a community like I did, small rural community. How many folks do you know that had that Air Evac Life Team sticker on their front door?
Yes, right.
Yeah.
It's a way that, like, again, at the basis of insurance, what is insurance supposed to do? It's supposed to be there when you need it. It's supposed to be there. No one pays a premium. We all hope we don't need it.
Yeah.
But chances are, at some point, all of us and all our families are going to find ourselves in the hospital. There are so many decisions that are not made logically when
Absolutely.
someone's in a situation like that. They're made emotionally or they're made out of fear. So a lot of people will avoid certain things because they're afraid of the cost. They're afraid of what will implications. They're afraid of the ripple effect. So having something like a hospital indemnity plan that, even if they're on a Medicare supplement, less popular for Medicare supplements, but these plans were built for Medicare Advantage plans. And they were built to a Medicare Advantage plan. Oh, you have a copay, you have a gap, you have something here where you're gonna a cost share. There's an opportunity for cost share. A hospital indemnity plan's there to kind of pick up the pieces if a consumer is interested in that.
Absolutely. And I think, to your point, they are highly customizable plans. And unfortunately, I think like the best thing about hospital indemnity is also sometimes the worst
They
thing.
can easily
Because
overcomplicate them.
especially as an agent, it's really easy to sweat the small stuff and worry about every single little rider, regardless of how often there are ever claims on those riders,
Yeah.
regardless of how big that cost exposure is. So, like, don't sweat the small stuff. I tell people constantly, like, they'll say, well, what's the best carrier? And I'm like, listen, the one that you're willing to write is the best carrier for you. We'll talk a little bit
100%.
about actual carriers later, but just pick one, get comfortable with it, develop a package that, is the one you would want to buy, and just present that to folks.
I think that's the biggest thing. You don't shop carriers, you shop benefits. You customize that plan for that consumer, which, again, big fan of. You mentioned a little bit about claims. I want to talk about claims because a lot of people, claims are scary, especially if you're really familiar and have only worked in the Medicare space, because we don't deal with 90% of the claims. Like, we just don't. Like, they're all done on the back end. I really like the idea. First of all, you said it perfectly. Claims for these products, an indemnity style product, so easy. It is so easy to do. I love that agents have an opportunity to be a part of the servicing side of this because, one, when an agent is directly responsible for somebody getting a check in the mail, that client's not going anywhere, and you're getting hella referrals from that. So a lot of people shy away from the claim process just because you're not used to it. Can you kind of like maybe shine a little light of like what does processing a claim with a HIP plan look like?
It's very simple. So pretty much every carrier is going to have their own claims forms, which we will gladly send over to you. Just ask. But it's going to be usually 1, maybe 2 pages of basic information like policy number, where they received treatment, what they received treatment for. You are probably going to have to get some information from the doctor to submit with that. But pretty much all of the carriers out there will pay those claims in less than a week.
I love it.
Maybe there's a little bit of follow-up if they just need some more medical records to verify the right CPT codes, but less than a week, those are going to get paid.
So I had it on the screen a little bit more earlier. I think why are hospital indemnity plans so important? I think they're important, one, because like just on paper, like they line up if gap in coverage or copay, cost sharing, hospital indemnity plan. But I think it's more important because of, I already alluded to it, it will make people more likely to go to the hospital and go seek emergency care, go seek care when they need it. And have less hesitation.
Absolutely.
It will keep your clients healthier. And quite frankly, if they live longer, they're on the books longer, you're making more money off of them. I mean, it's not like monetize lives, but I'm just saying it will keep people healthy because they will seek care when they need it. What do you think?
So I think one of the big things is we've all got kind of two, if you lump your MA clients into 2 buckets, you've got people who have some money and really want to keep it, so they're willing to bet on themselves and their own health, and that's why they go the MA route.
Makes sense.
They're going to be willing to maybe maybe they didn't want to spend the $180 a month on a med sup, but maybe they will spend the $40 a month on a tricked out HIP plan.
Tricked out HIP.
That's
what grandma's getting her. Tricked out HIP.
to really cover that exposure. And then you've got the other kind of bucket of folks that are on MA plans, which are the folks that don't really have money and can't afford to lose it. And they both need that hospital indemnity plan because it's covering their exposure. It's covering, it's helping the folks that have money and want to keep it. It's helping them keep more of their own money in their pocket. The folks who really can't afford those copays, it's giving them that sense of security, giving them that ability to use their plan the way it was intended and seek out the care they need.
That's such a good point. I think like the biggest thing here is people can't afford $0. You know what I mean? So like if a person's having a hard time coming up with that $180 a month, which it's a big amount for a med sup. Like if they're struggling to come up with that, then how are they going to come up with the $3,500 might move out of pocket, max out of pocket. The $6,700 max out of pocket that keeps climbing. Do we know what it's going to be for 2026?
We do.
Was it 71?
No. It's like 9.
Oh, geez. Okay. So if they can't afford that, how are they going to afford the astronomical amount of money that was likely to occur if they go into a hospital room? And we are seeing, too, that a lot of these companies, Medicare Advantage plans, are having to come up with how do they save revenue? We'll talk about this more this afternoon, but you're looking at a lot of people messing with 2 things. 1, co-insurances on Tier 3 and Tier 4 medications. 2, hospital stays and where they incur a lot of those monies. Zach said some carriers ask for a UB04 form. Unfortunately, Willoughby is processing the claims that were sent in on June 10th. I will say some carriers, Hospital Indemnity in particular, a lot of them, because there is very limited underwriting required for Hospital Indemnity. In fact, for most of these plans, I don't know a Hospital Indemnity plan that's not this way now. They're actually guarantee issue for between 2 and 10 years that these plans are actually guarantee issue. I also like these plans because they are really good for people under age 65 who are on ACA or group coverage. So there isn't really an age limit other than most do cut out at 85. But yeah, sorry. I know a lot of these companies, again, are if they underwrite them, oftentimes underwrite at the time of claim just to make sure it wasn't a pre-existing condition, that you're within the waiting periods and things like that. But we can work with you on what companies are less likely to do things like that.
Yeah, and I would say too, Zach, that expectation of 1 week turnaround is what I would call a broad generalization, and what we typically see. That doesn't mean there aren't certain carriers that are a little slower than that, certain carriers that are a little faster, or carriers that will go through periods of time where they where they run into some delays or issues or problems. So if you got a particular case, for sure reach out to the team at Senior Marketing Specialists, and we'll be happy to help you with that.
Let's talk a little bit about how do we sell it. Because again, I do have a hard stop in about 16 minutes to be precise. So how do agents sell it? It was actually advice that I got for those of you who are familiar with Bill Ellsworth. Back in the days, we'd been long retired now, huge fan of Bill's, but I early in my career, watched a webinar that he was teaching about how to sell Hospital Indemnity Plan. And it was basically just what we would know it now as FOMO. Just create the FOMO of saying things along the lines of when you're going, you have to incorporate it into your Medicare Advantage appointment. Yeah. So, and again, I'm talking more so for Medicare Advantage plan, but as you know, to do a compliant sales presentation, you actually have to go through those Medicare Advantage benefits line by line. Understanding when you have a hospital indemnity plan, if there is an area where there is a cost sharing of that Medicare Advantage plan, you just say the phrase, "Don't worry about that. I have something to take care of that cost later." And throughout your entire presentation, get to a cost share opportunity. Don't worry about that. Make sure you ask me at the end of this. I have something that's going to help offset those costs. Do that through the entire presentation. So by the time they're done, they're now asking you, okay, so what was that thing that you talked about that would help pay for some of those costs that I have? And now you're doing them a favor. You're discussing these benefits, discussing these plans. If I will say, I'm under the impression that if at some point we don't start incorporating hospital indemnity into our sales practices, I believe this about hospital indemnity and I believe this about cancer.
Yep.
If we don't start incorporating them and talking about them, those are E&O claims waiting to happen because we're saying that we're advisors on how to finance healthcare. Those 2 plans, in my opinion, are the top ways to finance healthcare and finance where Medicare is going to fall short. So just saying it's a really easy, streamlined way of getting them involved in the conversation early. You're not selling the Medicare Advantage plan and then trying to bring up a hospital indemnity plan. You're packaging them together to make them seem like a package deal.
Yep. And I would just say, sell it now. It's really easy to say, well, we'll pick that up during AEP. We will look at that during Q1 when we're not so busy. The minute you're sitting in front of a client is the right time to bring it up. Whether it's a current client, a new client, it doesn't matter. Don't feel embarrassed that you didn't bring it up last time. Yeah. Don't feel worried about how they're going to react. Does it just seem like you're trying to upsell them? You're you first of all, like you have to go into this with the right mindset. You're trying to get folks the coverage they need to be able to actually use their health care. So if you don't have that mindset, this probably isn't going to work for you. But if you just think of yourself as a salesperson, this probably
Right.
isn't going to work. But if you are trying to take care of your clients, this becomes a very easy conversation to have, and it becomes one that you can have today, tomorrow, the next day, not just a certain time of year.
I want to hear your opinion on something. Earlier on in my career, I heard this really interesting idea or this thought process behind adding a hospital indemnity plan. And eventually, this isn't the conversation. I do want to get to the 3-option close, which I think hospital indemnity, that's not this conversation, but just know I need someone to remind me that that's where we're going after this. There is an interesting idea that it's really difficult for somebody who is paying $0 to get them to pay $40.
Sure.
But to get somebody who is paying $140 to spend $180.
This has been a long time ago if that's what Part B was.
That was what Part B was at the time, right? So talking about reminding somebody, because it's really difficult to get somebody to move off of a $0 plan. Like right now I'm paying nothing. I'm okay with that. Everybody tells themselves, I'll save my money in case I need it. And then, but no one ever does. But it's really difficult to get somebody off of a $0 premium. So reminding somebody that they're paying a Part B premium can oftentimes kind of help move that needle, because you're no longer getting them from 0 to 40. You're getting them from almost 200 to 240. So, I mean, what do you think about that?
No, I think it can absolutely work. I think that reminder of, that removing that pricing barrier of 0 to whatever can make a lot of sense. But I think that's also just a way to overcome an objection. And if you work the hospital indemnity, the cancer, if you work any of these products into your sales process in the right way, that's an objection that really should never come up.
That's super fair.
So I don't think it's a tactic that can't work, but I also think it's an objection that you can overcome during your sales process and just not have to deal with.
Now, again, guys, keep in mind when it comes to any good cross-selling is never a and now or and then or here's this, now this. It is very much when a good cross-selling process, that's when we talk about the 8-step selling process, 90% of the cross-selling opportunity happens in the fact-finding portion of your appointment, asking about their risk aversion, asking what they're comfortable with, asking about their budgets. But I think hospital indemnity is one that is so perfectly that goes with, I bet that's not comfortable. I keep hitting this. Sorry. And then I did it louder. Hospital indemnity is one that makes the most sense, in my opinion, to sell during the actual education portion of the appointment, which a lot of them are, but I think hospital indemnity is a perfect example of that. Last selling point on hospital indemnities, what really works wonderful is to do a 3-option close. We obviously know statistics. We've been doing this for a really long time. Statistics say that people don't want the worst option. They also sometimes don't feel like they need the best option, so they go that B, that second option for that. So what a lot of people will do is they'll do, and some people, here's what I would prefer you do. Some people will start with just the standalone Medicare Advantage, and they say Medicare Advantage with no additional hospital benefit. Then they'll say Part 2 is a Medicare Advantage plan with a hospital indemnity plan, couple riders added. Option 3 is going to be a Medicare Advantage, hospital indemnity, cancer insurance. I'm actually going to just completely eliminate that first option and just say the first option is a base hospital indemnity plan with your Medicare Advantage plan. Option 2 is the hospital indemnity plan with cancer. Option 3 is the hospital indemnity plan, cancer, short term. You just pimp my insurance policy for those of us who were, actively looking at media in the early 2000s.
I'm sure most of you listening to this have seen, heard, read about, been beaten to death with this good, better, best concept.
Right.
And I really want you to kind of remove that from your vocabulary for a minute. This is catastrophic coverage, comfortable coverage, and secure coverage.
I think that's, if nothing else, I love that. Say it again.
Catastrophic, comfortable, and secure.
Okay. So I think that's a really great point to take away. 3 words, not good, better, best. One more time, Shaylin.
Catastrophic, comfortable, secure.
Getting that into your vocabulary, 1, changes your mindset, and 2, really does a better job, because it's not good just to have a Medicare Advantage plan.
No,
that's
absolutely.
not good. That is catastrophic. That is catastrophic. That is, if shit hits the fan, you're hopefully not going to go bankrupt. Now, my best friend Will asked a really great question. Is it compliant to sell a hospital indemnity plan during an MA only appointment per their SOA? You can sell a hospital indemnity plan as long as it's on the scope of appointment and they've initialed it during an MA only, PDP, Medicare Advantage, any appointment you want, and there's no selling season for it. Hospital indemnity plans is one of the best. Geo, if you guys are familiar with Geo, you're gonna hear a lot more from Geo. He sells a lot of insurance over the phone. He's an employee with senior marketing specialist, has been for a few years now, but he's an active agent. He says his favorite thing to do is when he gets a lead and they're working on a Medicare Advantage plan and they already have a Medicare Advantage plan, he's not going to change them. They're on the right coverage. He's going to do right by the client. He's not in for the sale. He will always write a hospital indemnity plan on those people.
Absolutely.
Because guess what? One, he can make an agent sound really incompetent by not suggesting a hospital indemnity plan. And two, he can now call them during AEP and proactively work with them during AEP on their Medicare Advantage plan. And you're not losing money on that lead. Like you're still if you get a lead, you can't sell a Medicare Advantage plan, you've lost money on that. Your cost per acquisition has gone up substantially. If you can still make a sell on that lead, then your client acquisition costs go way, 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 way down.
Yep.
I love it.
And here's the other thing I would say is oversell this product.
Mm-hmm.
Don't look at, most of the carriers that we recommend for this have great tools on customizing these benefits to fit around someone's MA plan.
Mm-hmm.
Match the benefits, match this, match that. I don't recommend that.
Okay.
Because I think you should, if someone's willing to spend the money for a hospital indemnity plan on that daily benefit amount, you should, if not max it out, at least max it out to what their market exposure is. Because the plan they're on this year is not the plan they're going to be on 5 years from now.
And you don't know what their health is going to do in 5 years, unfortunately. And anytime you do add to that benefit, unless they're still in that GI window, which for most companies is very big, every time you increase their benefits, they do have to go through that underwriting. Mm-hmm. So I think, Jalen, that's a huge point that we haven't, the market is adjusting to what MAs are doing, and we need to adjust the hospital indemnities to do the same. If they have a $350 per day benefit or per day copay, don't put a $350 on there. Sell them for at least.
I mean, just look at your market. Look at if they were on the worst plan in your market, what would their daily copay be? And take a look at that.
Yeah, and just make sure that again, I think it's gosh, Shaylin, you're killing it. I'm glad you're here today.
Well,
you're pretty helpful.
Here. I try to be.
You guys, let's talk just for the last little bit about the who do we recommend for these hospital indemnity products? Obviously, a flagship product is going to be GTL, Guaranteed Trust Life. They've been GTL and these plans have been around for forever. Yeah. And a lot of companies, hospital indemnity plans, within the last 5-8 years, started making a lot of sense to a lot of people. Mm-hmm. And so a lot of companies have recently launched hospital indemnity plans, and all of them refer to GTL or a GTL lookalike. Yep. GTL was the first and the only for a long time to have guarantee issue windows for these plans, so keep that in mind. But GTO, when it comes to existing business, I've not heard any issues with them filing claims. Nope. I've heard nothing but really positive things. And they've actually had benefit increases and rate decreases on current books of business in the past.
They have.
So they are one that they've been doing this for a very long time. They're priced in the market. They are wonderful to work with. The other two that I would recommend would be Mutual of Omaha just launched one. Yeah. And in some states, not everywhere. But what I loved about Mutual of Omaha is, one, you have the brand name. You don't. Absolutely. The average consumer isn't going to know GTL, unfortunately. Sure. They do know Mutual of Omaha. They talked about how they did some test runs, and they sent out 300. Where was it? It was in some area. They sent out basically no contacts, nothing. Just send it to current people, not Mutual of Omaha clients. Just sent it to people of age, and they said they got 30% back of just signed applications for this hospital indemnity product, and not all of them were Mutual of Omaha current clients. So the name of it sells itself, and it's a great product. Again, another one that mirrors GTL. The third one I'm going to say is Heartland National. Yeah. A GTL mirror. The difference between Heartland National and GTL is that the commissions on Heartland National are going to be a little higher, but the premiums are going to be a little bit higher. But very, very similar. Great product, great team there. I think you rate one of the three of those, you're gonna do really well. You're doing right by your clients.
Absolutely.
So, Ben, I think, like, again, just kind of great point in line with what Shane was talking about earlier. They have a guaranteed purchase option rider, basically that if your client needs to increase their benefit to deal with
Just a buy-up
inflation,
option.
they have that buy-up option. It is an additional rider. Shaylin, if you were writing riders, again, this is my last question I can ask. If you were writing a rider for a hospital indemnity plan, what riders would you do?
Observation, stay, ambulance, and cancer.
100%. Now, are you one that you like to? So here's a question, because I think next week we are talking about cancer insurance. Make sure you're staying tuned. Are you one that you would write a cancer insurance rider or a cancer insurance separate policy?
So here's the thing. Again, I absolutely would love to see everyone write separate policies, but as with everything else, the one you write's better than the one you won't.
Yeah, I am here for it. We'll talk about that more next week, about what is the difference between I'm going to write a cancer insurance lump sum policy versus I'm going to write a cancer insurance rider, especially with GTL, because the lump sum policy, GTL, cancer insurance is identical to the rider on hospital indemnity plans. There's pros and cons, and we'll talk about that more next week.
Yeah. My last thought on it would be, if you start looking at benefits, you're going to have some combination of choices where you can do either more days and less dollars, more days, stretch it out. Most of those Medicare Advantage plans are going to have a maximum of a 7-day window where someone's, needing to pay hospital copays. I am always going to be a fan, as long as the finances are about equal, and usually they are. I'm always going to be a fan of a shorter number of days with a maximized payout.
I love
because it is really hard anymore to stay in the hospital 3 days or longer. Hospitals don't want you to end up in that nursing facility, don't want to deal with the hit to the readmission rates. It's hard to stay as an inpatient more than 3 days. If you can max out a policy for 3 days or 5 days, and it's about the same as stretching that out over 6 or 7, do it.
Got it. So fine, if you ultimately want to get $1,500,
do $500 a day for 3 days instead
versus
of $300 over 5.
Nailed it. Quick math. Look at us go. Guys, I have to jump off here. I do appreciate everybody's patience, understanding, love, kindness, and just general support of the Medicare Cafe. Again, we are going into some crazy, crazy updates. If you want more from Chandler and I, we are jumping on the Integrity Disruptions webinar today at 2. Make sure you join. Go to our smsteam.net, click the events tab, and you can watch us there. Us and our good friend Ted will be talking about what more you can expect this AEP. More information is coming out. What's going on with the big, beautiful bill? What's going on with the pre-authorizations? Everything's chaotic. I love it. Join us at 2 to find out more information. So until next time, y'all, have fun.
Make money.
And give impeccable service. Gosh dang it. On a roll today. Thanks, y'all.